1.4 billion Ghana cedis. And that is obviously about 9.4% in increase in the 2023 budget, and then it also represents more than 11% of the total expenditure in 2026. Out of these amounts, we have the National Health Insurance Scheme that takes around 11 billion. And as I indicated the last time, we are voted into power to solve problems. And so we inherited some challenges with respect to the National Health Insurance Scheme. If you all recall, the National Health Insurance was capped, and it was bedeviled with delay in the payment of claims, unrealistic payment of tariffs, and a lot more, co-payment. And so since we took office, His Excellency, one of the policy directives he gave was to uncap the National Health Insurance, so it still remains uncapped. And there is now prompt releases of funds to the National Health Insurance Fund. Gone were the days where you hear service providers shouting on top of their voices on the rooftop that they were going to withdraw services because they were not receiving payment. And this is no more the case as I speak to you now. In some cases, my CEO will have to call even some of the service providers to bring their claims for payment. That is the current status of the National Health Insurance Authority. And so it is not by coincidence that there is a lot of confidence in the National Health Insurance Scheme. The coverage was around 18 million people as at the time we took office, and I can confidently report that in a matter of less than 1 year, we are around 20 million people, which represent about 60% coverage. And beginning next year, we are going to increase the tariffs in the National Health Insurance to the service providers, because it is something that the service providers have been complaining about, that the tariffs we give them are unrealistic. And so government has taken the decision to increase the tariffs about 120% on average. And I believe this is going to be a game changer. Again, we all know that primary health care accounts to about 80% of our health needs, especially in this country. And so when we have our primary health care right, I think that we'll have a very strong health sector. So His Excellency the President has directed that beginning next year, we have to roll out what we call free primary health care. And we'll be looking, in addition to the curative, we'll be looking at enhanced promotive health care, we'll be looking at enhanced preventive health care, and that will give rise to the early detection of the diseases, not to even get to the complication stage. And some 1.5 billion Ghana cedis has been allocated for the free primary health care. And let me be quick to add that this will still fall under the National Health Insurance Scheme. We are not going to reinvent the wheel, and so it will fall directly under the National Health Insurance Scheme. We are in to solve problems. Again, about 4 out of every death we record in this country is due to non-communicable diseases. About 4,000 people are diagnosed of cancers every year. 1 out of every 3 adults we see in the street is hypertensive. Diabetes is rising. And so His Excellency promised the good people of this country to have solution to this problem. Hence the establishment of Ghana Medical Trust Fund, popularly known as Mahama Cares. I am happy to report that the status of Mahama Care is that, 1, the bill has been passed into an act, the board has been inaugurated, the secretariat is in full operation. And therefore, they've started disbursement for patients' care at the moment. Maybe before we end this session, I'll put out their telephone numbers so that if you want to have access to them, you can do so. And it's a very simple procedure you may have to go through. Your specialist medical doctor may have to apply on your behalf. And once it gets to the secretariat, within 14 days, they must respond to your application. And so Mahama Cares has also been allocated an amount of about 2.3 billion. So they are not worse, there are no more promises. These policies are seeing figures allocated to them, and it is not ordinary figures, as we have already demonstrated in the in the case of the National Health Insurance Scheme. We will do prompt releases. In fact, let me put it on record that since the establishment or inception of the National Health Insurance Scheme, no government has been able to pay promptly like we are doing today. No government. No government. Again, infrastructure. We now have 16 regions. And so 6 out of the 16 regions have lived for the past 7 years without any regional hospital. His Excellency promised the good people of this country that he was going to construct 6 regional hospitals in the regions where there are none. Fortunately enough, in 2026 budget, we are going to begin the construction of 3 regional hospitals, namely the Savannah region, the OT region, and the Western North region. And some 600 million Ghana cedis has been allocated to that effect. So when I say this budget is health-centered, I mean it, and I know exactly what I'm talking about. In as much as we are constructing new district hospitals and new regional hospitals, His Excellency the President has again directed that no uncompleted health facility will be abandoned. We will continue to pursue La General Hospital, Confanoche Maternity Block, Sewia Regional Hospital, Agenda 111, and all other CHIPS compounds. Don't forget that every district is supposed to construct not less than 2 CHIPS every year, and that would add up to our numbers. Retooling. A health center is not just the building, the personnel, the building, and of course the tools, the equipment. Our status of medical equipment in our health facilities is very dire. The situation is very dire. The last time we did a major retooling in this country was His Excellency John Dramani Mahama I administration, the first administration. Since then, our health facilities have been suffering. We have reports that indicate that more than 50% of our CHIPS compounds do not have basic equipment, basic ones. And therefore, as part of the free primary health care, we are going to retool our primary health facilities to have the basic equipment to be able to deliver, to give real meaning to free primary health care. We are not only going to do that, we are seeking to establish 3 catheterization centers, namely the Kolebu Teaching Hospital, the Confanoche Teaching Hospital, and the Tamale Teaching Hospital. We are buying DNA testing machine. The last time I said that, I saw a lot of infographics about me and suggesting that I was going to insist on compulsory paternity tests. I'm sorry, that was not coming from me. So you must disregard that. And so we are going to buy DNA testing machine for Noguchi Memorial Institute, and Mahama Cares will also be seeking to retool some of our teaching hospitals and then the regional hospital to be able to treat the non-communicable disease. In all this, we have brought the private sector in because government cannot do it all alone, where we'll be looking at the private sector bringing their equipment to the health facilities, and they will be paid. When they put up their claims, they will be paid either by the National Health Insurance Scheme or by Mahama Cares. Now we have more than one health financing scheme. And so that is what we are doing. With respect to the workforce development, out of the 34 billion Ghana cedis, some 16.7 billion has been allocated as compensation. And so we'll continue to pay the 13,500 nurses we put on the payroll this year alone. We are distributing not less than 700 medical doctors across the length and breadth of this country. And His Excellency the President has directed that we send these medical doctors to where they are needed most, especially the districts. I'm sorry to say that we have more than almost 50% of the medical doctors we have in this country in the Greater Accra. And therefore, let me take this opportunity to appeal to the medical officers we are posting here at the moment, not to see this policy as punishment, but as an attempt for equitable distribution of the workforce we have in this country. And of course, government will also be seeking to create that congenial atmosphere for you to deliver your work. That notwithstanding, we have paid some 500 million Ghana cedis for the nursing trainee allowance. And first week in December, we are going to pay 231 million Ghana cedis again. So we are not piling up arrears. We are paying promptly the nursing trainee allowances. At this point, let me use the opportunity to clarify the happenings in the Zipline, the drone services. A contract was signed in 2018. It took effect in 2019. And as part of the contract, there were clauses known as take or pay clauses in the agreement. And the contract was so sourced. Now, for every month, Ghana government was and is supposed to pay $88,000 per center per month. $88,000 per center per month. So if you do the computation, we are paying more than, because we have 6 centers, so we are paying a little over $500,000 every month for the services of the drones. What is more interesting, and I think everybody needs to know, is the fact that in the beginning of this contract, the idea was that we were not going to use government of Ghana money to pay the services of the drones. And I have the Hansards here during the debate on the floor of the House. And the quotation from the then minister responsible for Health, Ajimamanu, I have it here. I think that the question was asked about why the signature of the minister responsible for finance then was missing in the contract. And he had this to say, among other things. Mr. Speaker, I would want to stress again that the Honorable Minister for Finance did not put his signature on, because this is not going to be done from the consolidated account. The public purse is not going to come in here, unquote. And the whole discussion has to do with the fact that they were not going to pay from the government of Ghana fund. And some other stakeholders were engaged, and I've had the opportunity to verify from them, including the GMA then. And same argument was advanced. Apart from saying this on the floor of the House, government of Ghana has paid a lot of money to the Zipline. Apart from that, their services was to concentrate on the hard-to-reach areas and emergency services. But upon review of the activities, what we have realized is that the hard-to-reach areas constitute only 12% of the activities, 12%, 1-2. And emergency services is 4% of the activities. And it will interest you to know some of the items they fly. Items like condom, blood donor cards, not blood donor cards, mosquito nets, food and nutrition items, adhesive tapes, syringes and needles, education materials, among other things, textbooks, exercise books, uniforms, and a lot more. So these are some of the items they have been flying. And so when we came to office, we think that there must be value for money. And therefore, we are engaging them. So if you hear that we are not engaging Zipline, it's not true. We have met more than 3 times, and we are still engaging them to know how we can have value for money. And that is what His Excellency the President has directed us to do. That in our respective ministries, we must make sure that whatever we are doing, we have value for money. I think at this point, I want to pause here for your questions. I thank you for the opportunity.
All right. Thank you very much, Honorable Minister, for that crisp and concise presentation. So we would invite questions from members of the media on the issues highlighted by the minister or any other matters relating to the health sector. If you have a question, as we do it here, please get to the microphone on my left, identify yourself, and then ask any question that you may have.
Okay, so my name is Wisdom Hedejime. I work with the XYZ Broadcasting. Minister, there are reports or accusations that the monies that's supposed to be given to the NHIA, those set of money has been channeled to the Mahama Cares, and that you are shifting attention from NHIS to Mahama Cares just to make a name. How do you respond to that, sir?
All right, thank you very much. Is there any other question, please? So in the interest of time, I would ask that as many here as have questions come to the microphone so that we do not have to experience a lag between when you walk up and the time you ask the question. So please go ahead.
Okay, I am Akosi Aocho. I work with City FM. And so, Minister, you indicated that government is putting in efforts to ensure that the Mahama administration completes, there will be no health facilities uncompleted. In the 2026 budget reading, the finance minister indicated that at least 10 hospitals of these Agenda 111 projects will be completed by 2026. So doing the calculation, I want to find out, in your own estimation, how many hospitals out of these Agenda 111 projects will be completed by the end of your tenure?
All right, thank you very much.
Good afternoon. My name is Emmanuel Romeo Tete, and I report for Ahonto FM. Honorable, please, currently there are some pressure from Parliament, especially from the majority side, to cancel the Zipline contracts. Although there are some engagement, as you said, please, will it be cancelled? Thank you.
Thank you very much for that direct question.
Thank you. My name is Abdul Hanan. I work with the EIB network. Minister, I want to find out, there have been widespread reports about the delay in the rollout of the games system. In some areas, the slow pace is being carried out and patients are frustrated. What is the true state of the new system? And Ghanaians wants to know. Secondly, I want to find out, the National Health Insurance Authority allocated 10 million Ghana cedis at a time when you were ranking member in Parliament. And currently...
Allocated 10 million to what?
The NHIS.
10 million Ghana cedis to the
Yes,
NHIS.
10 million Ghana cedis.
You may have to relook at those figures. It's not, okay, you finish the question, perhaps.
Let me finish. Okay. So the second question is still on limbs. So when you are done, I will come back. Thank you.
Okay. All right. You have another. Please come in. Please come. Yeah. Okay. All right.
Good afternoon, Minister. Andrew Annan, Pharmaceutical Society of Ghana. In your earlier address to Parliament earlier in July this year, you mentioned that there's...
Please look into the
camera here. In your earlier address to Parliament on the floor of Parliament earlier this year, you mentioned that you are prioritizing the recruitment of health professionals, including 1,621 pharmacists. We want to find out how far progress on clearance for these permanent recruitment of pharmacists is coming? Thank you.
Thank you very much. All right, so the minister would at this stage answer these questions. We will come back for another round of questions if there are any. Thank you very much.
Thank you very much for your questions. The first question is coming from the fact that we are taking money from National Health Insurance for Mahama Cares. The point must be made strongly and forcefully that let us not forget that the National Health Insurance was capped before we took office. And that capped amount of money was not expended in the health sector. What His Excellency the President is doing at the moment is that, look, I'm not going to cap the National Health Insurance. Whatever money it is, let's push that money back into the health sector in the interest of universal health coverage. And so, if we allocate some of the National Health Insurance levies to the Mahama Cares, it's not out of order, and it's been passed by Parliament. And so, the strong point that must be made is the fact that we have not capped, and therefore we have raked in more, and contrary to what others did, taking the money to do other things, we are still investing in the health sector. And it is only one of the sources of revenue for the Mahama Cares. We have other sources as well. In fact, corporate Ghana is encouraged to even contribute to have some tax rebate. It is in the law. It is in the Act. And you have also realized that there are other individuals and companies who have contributed to Mahama Cares, including appointees. So that is not the only source. And so for me, there's absolutely nothing wrong in investing health money in health. Now, how many of the Agenda 111 will be completed within our tenure of office? It is our expectation that we will complete as many as possible. But apart from government's direct allocation to completing some of them, we are also going to involve the private sector. We are going to bring the private sector in. We are encouraging the mining companies. Wherever we have Agenda 111 that is uncompleted, there's a mining company there, we're encouraging them to take it over, complete it at quick pace, and you partner with government to run it. I mean, Maritime, they have hospital. Bank of Ghana has hospital. There are other corporate bodies with hospitals. There's absolutely nothing wrong with it. If the others will also come on board, partner government to have some of these hospitals. So we are seeking to complete as many as possible. We are not going to abandon any of them. Whether or not to cancel Zipline, we have not gotten to that point yet. We are still engaging them. When we get there, you will hear what decision we will take. I mean, everybody has a right to also express his or her opinion, including members of parliament. Games. We have started the rollout. It is not without a challenge, but I can assure you that we are not interested in lamentations and getting back to you with the problems and challenges. We are concentrating on the solutions. And so whatever it is, we are confronting the issues. The rollout is still ongoing. There are the teaching hospitals. The teaching hospitals on from department by department. There are a lot of departments in these teaching hospitals. And so we are expediting action on the rollout. But let me also add, I've heard concerns from the public that there has been loss of patient data. That cannot be correct. That is not accurate. The last time I came here, I told you that we were reconstructing the data from the National Health Insurance angle. And at the moment, we have reconstructed not less than 16 to 18 million patients' data, which is around 80 million records. And so you know, there were two things we spoke about that went wrong. The fact that the software didn't belong to the state, and the fact that there was no middleware exchange. Now what we are doing is that government will own the software, and we have already constructed the middleware, that exchange. So that exchange now contains the records, the data. So as and when they get to your facility and you are plugged in, you have access to every data of every patient. And those who are attending, hospitals or health facilities now, where we have not gotten to, we will then scan the hard copies when they get there onto the system. So nobody is going to have any data or any record lost in the system. So that is the point. Recruitment. Yes, I have made a point that 2025 alone, we have put 13,500 on the payroll. It's not a matter of recruiting alone. If you recruit, you must pay them. You must make the financial provision. And on the issue of recruitment, the most important thing is not the recruitment. The most important thing is the provision of the finances to pay them after recruitment. And so we have put 13,500 people on the payroll, and we are still engaging the Ministry of Finance to get more. Thank you.
Yeah, thank you very much, Honorable Minister. Yeah, Max, walk up to the microphone with your question.
Thank you.
If there are any others, I would encourage you to join Max presently so that we can maximize the time.
Thank you. Honorable Minister, the last time you were here on the issue of games and then limbs, I asked the question about him being the ranking member of parliament at the time that contract was signed, and he stated that the contract didn't have to, come to parliament. My question is emanating from what my colleague Hanan was trying to ask. In fact, if you look at the National Health Insurance Fund allocation for 2024, an amount of 10.5 million Ghana cedis was given to the Ministry of Health as support for monitoring of health projects. And at the time, the Honorable Minister was the ranking member of the Health Committee, and we know they have oversight responsibility over the monitoring of these health projects. I want to find out, at the time, did the monitoring happen? Did it come to his attention, some of the reasons that were stated for the discontinuation of the contract with LIMS, such as underperformance? At the time, did the issue of underperformance come up during the monitoring of the projects? The second question also is a public interest question. I want to find out from him if he has directed CHAG to stop using LIMS. Yeah, thank you.
All right. Hanan, you're back after reorganizing your thoughts.
All right. It's still the same, but this time around, more clarity.
Sure.
10 point.
We appreciate the clarity.
Yes. Yeah. 10.45 million was allocated from the National Health Authority for the monitoring and evaluation of the LIMS. At the time,
for the LIMS specifically?
Yes. At the time, Honorable Minister was ranking member in Parliament. So, was there a report after this monitoring and evaluation was done? If it is bad or good, why has the report not been published? If it is published, what is contained in this particular report?
Okay.
Thank you.
All right. If there's any other question, we'll take it at this stage, because we will not be coming back after the minister has answered them. All right, Honorable Minister, you may now take the floor.
Thank you very much for the questions. This is how Parliament works. In Parliament, when the ministry brings their budget, we sit and play oversight responsibility on the budget. Once we approve the budget for the ministry, the day-to-day running of the ministry, whether or not something must be done, falls directly under the minister responsible for the ministry. The day-to-day running of the ministry falls directly under the minister. That's the first one. Now, the second question has to do with whether or not I have directed CHAG to stop using limbs. We have directed all health facilities under government to give games the full cooperation to roll out games. Thank you.
All right, so Honorable Minister, thank you for that very. Okay, Honorable Minister, there's a question about some monies allocated in the 2024.
We approve the budget. So the ministry will come and tell us this is what we want to use the money for. Then we approve for them. And so when we approve the budget for them, they will have to go and then do whatever they want to use. Our responsibility is for the approval of the budget. And so once we approve the budget, the next thing to be done, which is the day-to-day running of the ministry, must be done by the ministry, not the ranking member. And that is why I'm answering this question this week. If you had asked me about 2025, which we are yet to maybe account, what I use that money for as a minister, that I'll tell you what I did with that provision. Then I'll tell you. But maybe this question, my brother Okuboy or Ajima Mandu must be here to answer that question. But if you ask me about 2025, then maybe that falls under my purview. Or if you want to file a question for me to go into that to bring you better and further particulars, I'm willing and ready to do that.
Yes, and I might add, seeing as I'm an MP also these days, that the budget process also involves accounting for the outturns of the previous year. So the onus has always been on the government that did the allocation to account for what the money was used for. That is what we will be obliged to do when we go for our budget estimates as part of this budget approval process. So it is imperative that those of you who ask the questions also acquaint yourselves with the process so that we do not ask questions in vacuum without laying down the proper context. Yes. If you have outturns that point to a particular utilization of those amounts, then we can latch onto it and do further discussions around it. But as we speak, there's little to hold on to, seeing as those who disburse those monies have not, in our estimation, offered any explanation as to how those monies were used. Also, fundamentally, legislative oversight does not excuse executive responsibility. Every money that is allocated is done in the name of a particular ministry, department, or agency. They ultimately have to account for it. So it is important that the question is properly situated. On that legislative note, I thank you all for coming, and I hope to see you another time. Thank you very much.
Hello to you again. You're welcome back from the Jubilee House, where we've been bringing you live pictures from the Government Accountability Series. Health Minister Kwabena Mintah Kando there taking his turn. He did mention that government is ensuring the prompt payment of monies into the National Health Insurance Scheme following government's decision to uncap that scheme. He did admit, though, that portions of the National Health Insurance Levy is going to the Mahama Cares program, which he says has already begun disbursement of monies to patients for their care. On the controversial Zipline story, whether or not that contract has been terminated, the minister says they are engaging Zipline to ensure value for money, and so we do not know what would happen at the end of those engagements. You're still watching Channel 1 TV. Keep watching. My name is Charles Osukumi.